Here. So driving and dementia. This is it's a complex topic. It's a very important topic. So I'm glad you're here today because most caregivers at some point are going to face the fact of driving with their loved one. Some people are got to take the keys away. What are we going to do? This is dangerous. So we're going to talk about all the complexity of driving and dementia, why it's complex, and what we can do about it. So we are going to, as we talk about driving, I want us to think and really start to think about this is more than just transportation when we're talking about driving, because driving is independence. It's freedom, right? It's not necessarily just getting from one place to the next, but and sometimes it's an identity for some people, right? So we're going to talk about how to transition or how to approach this transition with compassion, but with good planning, how to have the conversations. So hopefully we leave today with practical strategies, understanding what the warning signs are, but those practical strategies for what can I do? What can we do next as the family member, the care partner, whatever it may be that we're working with this very complex situation, right? And when I think about driving is actually a very complex task that we do every day, even though it might like come second nature to us, right? Or sometimes we don't pay attention as much as we should be paying attention when we're driving. But it does require our brain to process many different things at once. I mean, there's speed limit, there's traffic lights, there's road signs, there's pedestrians, right? All of that stuff demands our attention and it demands our brain to work quickly to assess and judge and analyze and make decisions. With dementia, however, dementia affects the brain. And so it does affect memory. It does affect judgment. It affects visual spatial, so how we're seeing the world and where we are in relationship to objects or other people. And it also affects our speed of processing information. How quick do I process that information and then making the right decision or making the most appropriate decision? And even in the early stages of dementia, these changes that happen really can make driving unsafe. Now, I want to say, just because somebody maybe has early stage dementia or even mild cognitive impairment, we don't necessarily have to automatically just take away the keys from them. We're going to talk about transitioning away from it, but knowing that eventually somebody with dementia cannot drive anymore because it's too complex and it is unsafe. But dementia reduces our reaction time, our decision-making capabilities, and how fast we can make those decisions. Awareness of our surroundings also, right? Just where our surroundings are in the car, but also all these things around us. Dementia is going to affect those when that, of course, is critical for just the safety of driving. And on the screen here, it pinpoints out all the different areas of our brain that play essential roles into good driving skills. A few of them I'll point out, but just our frontal lobe, which is where our forehead is, this anticipates potential danger. How do we respond to situations? It's our multitasking, and driving takes a lot of multitasking abilities. It's that decision making, that quick decision making. The parietal lobe, which is kind of over here, this is a lot of our perception of our world or perception of what we're seeing and how do we make sense of it, how to manipulate objects, but also our senses. So, we're seeing signals from traffic lights or even like construction work. We're seeing those signs or the lights or lights from a police or an ambulance that comes by. It's all being processed up here in the parietal lobe. Our attention also is housed there. Of course, our occipital lobe, where we see, right, we're taking in all of those images. And that occipital lobe is taking in the images and translating, interpreting it so we can make appropriate responses. Temporal lobes do control our hearing, categorizes objects that we can see there, and process some visual perceptions as well. And then, of course, our cerebellum, way back here, this is our maintains our balance, but it's also our reflexes, our muscle movement, even small ones, hitting the brake or hitting the gas, honking the horn, whatever we need to do. And the brainstem also controls and also our alertness. So the brain, a lot of things are really involved, and all of these things have to be processed simultaneously when we're driving. Driving is very complex, so it's important to understand, well, when dementia is introduced and there's brain changes that are happening, what dementia can do. Because dementia is going to slow our reaction time. Talked about it's going to be much harder to multitask. Getting lost in familiar places, judgment's going to be not near as, this is even in the very early stages. Confusion with the traffic lights and construction and all those things. And what happens a lot of the times is families or care partners, we might notice subtle changes at first. In these subtle changes, we kind of look at these, hindsight is 2020, and it's like, oh, I did notice mom starting to do that. But in the moment, we may not catch on to it. Because it could be that they're missing familiar turns at roads. They may hesitate at green lights or yellow lights, not entirely sure what do I do with that yellow light. Misjudge how fast cars are coming or how fast a car is moving. If we're trying to pull out, we might not see how fast they're coming and pull out in front of them, or not pull out at all. Okay. I had one lady, a daughter that I was working with, she said that her father was starting to stop at the green lights. So he would just kind of see the lights and knows on stop. So he was getting confused with the colors and what to do. So he would stop at green lights. But when the yellow light was on, he just drove through it. It's like he didn't see it, right? So those are subtle changes that we start to see. But even if we start to see these subtle changes, I'll share a personal story. My mom had signs of dementia before she passed away. Her anxiety shot through the roof when she was driving. That was a sign that we, hindsight 2020, could have looked back and said, oh, when she was driving, that anxiety just skyrocketed. And that also affected how she was driving and how she was making decisions, right? So we noticed that, but all of these risks are going to be increased over time. So we see these, and sometimes it might even be that they're having a hard time navigating familiar places. Even they might have driven that route many, many times. They're starting to have a hard time. They're just having a harder time navigating that or making decisions on where to go or where to turn. And this is a list of certain warning signs that are not necessarily as subtle. These are kind of big ones. Because these are signs when we start to see these, it's time to act, right? If they're getting lost in places they've driven for years, then safety is a risk. If they're confusing the gas pedals and the brake pedal, if there's unexplained scrapes or dents in the cars and they can't remember what happened, that is a concern. Of course, getting more traffic tickets, police warnings, and they're not having any recollection of it. And then, of course, accidents or near misses. Waiting for a major accident to happen is not the safest plan. But I also know that as families, it can be a tumultuous situation to have somebody stop driving. And as much as we try, they'll still try and they'll still drive. And we're going to talk a little bit more about that. And so we just kind of throw our hands up sometimes when there are other steps that we can take to where it's not, well, we were just going to have to wait for an accident for him to stop driving. That's not the plan. That's not the safest plan. And we'll talk about some other steps that we can do because we want to act before somebody gets hurt. And really the best rule of thumb is even acting a little bit early is better than waiting for an accident or for somebody getting hurt. So even if we have dad or spouse stop driving maybe 6 months too early, right? They still could have had some more times to drive. That's a safer plan than waiting for an accident to happen. Oops. So let's look at some warning signs. And we've talked about some of these already, but I want to go and dive into them a little bit more because early signs can be very subtle. Um, and some of these are warning signs they kind of or safety measures they put on themselves. So they might stop driving at night. That's a safety thing they've done. They've self done that. I'm not going to drive at night anymore. Or they don't get on the highways anymore. Or they're comfortable driving a familiar short route, like it's from here to the grocery store or here to CVS, but going anywhere else or a farther distance, they're not as comfortable driving. So it's easier for them to give up the keys or control of the car on those routes. So we can see that. And really, up here, if you notice they're having a hard time staying in the lanes, they're not parking like they used to, increased anxiety, like I mentioned. But even if you, as that family member, feel unsafe as a passenger, then we really need to trust our instincts. We're going to talk, I've said, well, it's a transition and you don't automatically have to pull the keys away just because they're starting to have some memory challenges or thinking challenges. It really is an evaluation process. But if you're feeling unsafe, then we got to trust our instincts for that. We have to, even if there's not a formal diagnosis, is what I'm trying to say. Because some people will have a diagnosis and we're evaluating, well, when do we, cut off driving, or what does that transition look like? Some people might not have a formal diagnosis yet, but there's something wrong. And we need to trust our instincts with all of that. And really, a lot of places, the National Institutes on Aging, the Academy of Neurology, the Alzheimer's Association, James L. West, we all recommend that monitoring for early driving changes once you start to see signs. So you don't have to have a diagnosis yet. If you're starting to notice something's not quite right, then this is when we need to start monitoring for these early warning signs. And this is a list of other warning signs to look at. We won't go over all of these. This is for you to look at in the future. But I want you to also think about using this as an objective list, whether you're using it for yourself or you share it with other family members, because sometimes this transition from driving to not driving can be a family conflict. It's not just between you and your loved one with dementia, but it can be a family conflict, unfortunately. But if we can use some of these warning signs here as an objective way to monitor, well, let's look at these changes and these driving skills over time. Now, the list here, the signs are ranked from more minor to more serious. So number 1 is minor, number 27 is more serious. So they're kind of ranked a little bit in that order. But if you're using this as a objective tool, this helps us make more informed decisions. It helps us make less emotional decisions and can really be useful if you're having to talk to other family members, but really useful when you're talking to healthcare providers or like a Department of Public Safety, those things like that. And we want to consider that this is an objective list that we can use with third parties, but also with ourselves. Now, with dementia, what happens and where we tend to see a lot of pushback is persons with dementia do have limited insight on what their abilities and their skills are. And this can be one of the hardest parts of it because our person doesn't see the problem. This is an effect or a symptom of dementia. They don't have insight, or there's a lack of self-awareness about what's risky or what's not, what their abilities are, what their abilities are not. So a person may remember or know, well, I've been driving for 50 years and I've never had an accident. I'm a very safe driver. I've never had a ticket. That's what they're remembering and that's what they're recalling. And that's what they'll use. They're not going to necessarily remember last week's near miss right? Or they can't explain the scratches in the side of the car. And this is the changing that's happening in the brain. It's not necessarily stubbornness or them trying to be difficult. These are just changes that are happening. So sometimes we do have to ask ourselves, are they really aware of what their skills are? And of course, this can change from day to day also, right? One day they might be more aware than the next day. So we might keep that in mind as we're working through this. But people with dementia will tend to overestimate their skills or be overly, they think they're better drivers than they really are. And this could be their past person, and it could be just now, right? I probably overestimate how good of a driver I am. But if you ask my husband, he would say differently, you know. Uh, they also might lose their ability to assess the situation. Again, judgment and reasoning is affected early on in dementia. So just judgment of what those abilities are and reasoning out with them is going to be a little bit harder. But we're going to talk about some tips on having that conversation because a person with dementia can reason, but it's a false reasoning, or it's not based in our reality. It's based in what they're recalling, those last 50 years of safe driving. Because they can say something like, well, just because I got lost this one time doesn't mean I can't drive. I heard my mom say that a couple of times. I hear a lot of people say, I've never had an accident. Why should I stop driving now? Or I've never gotten a ticket. Or they're just saying, I'm fine, I'm fine, I'm a great driver. I always make sure I know where I'm going. I always go the speed limit. Don't worry about me. So they're reasoning, but it's a false or an inaccurate reasoning. Mm-hmm. But I want to talk a minute about medical and legal considerations because this always comes up. So what happens is we can use persons in authority to help us with this decision, but also help us with the transition. A lot of times a doctor can be a huge help in helping us transition our loved one out of the car or away from the keys. But I want to make it crystal clear that doctors can assess health conditions that affect driving. So they can assess like slowed reaction times, they can assess memory challenges, decision making, judgment. They can assess those symptoms. A doctor is more than likely not going to tell you yes or no, your loved one is safe to drive. Because they really can't tell you that, but they can tell you, well, their reasoning, their speed processing is bad, their judgment is not great. They can assess those symptoms. What they should be able to do is refer you on to a formal driving evaluations. And I just have it on here, and this is Tarrant County. So for those of you that aren't in the state or in Tarrant County, you may have to look this up where you're at. But in Tarrant County, our formal driving evaluations are through Texas Health Resources. And there's one in Arlington, Fort Worth, and Plano. But we can use these recommendations essentially from our healthcare providers to then take it on to the Department of Public Safety, or they can refer that on to the Medical Advisory Board. And this is also done through the evaluation process, the formal evaluation if needed. But they can advise and recommend to the DPS or the Medical Advisory Board on whether it's safe for you to drive or not. Now, there are some states, this is also state specific, so please look it up and where you are at. But in the state of Texas, you'll hear doctors it is not mandatory for doctors to report somebody has dementia or they're unsafe to drive. So reporting is voluntary. However, they can make recommendations. So they can submit a recommendation or a confidential concern to the Department of Public Safety. They can do that. Family members can do that. Law enforcement can do it. And it can be done anonymously as well. If you're worried about that, it can all be anonymous. But Texas does not require doctors to report. And then the medical advisory board does review the cases. They take in the recommendations from healthcare providers. Maybe there's law enforcement, maybe there's been accidents or something. They'll take all that into consideration, whether they can say they can revoke the driver's license or not. Now, what a doctor can do, that's not a formal thing, but they can write a prescription to say, you should not be driving for the next 6 months. They could put it on a prescription bag. The doctor can say, I don't recommend that you drive. They can ask you to stop driving, but it's not they can't revoke the license or anything like that. But it can be helpful for a doctor to write it down, and this is prescription, and it is for the next 6 months, you cannot drive. Because, and it could also be like we've started a new medication that affects your senses. We can use these therapeutic stories also to help. As opposed to we're just like, well, you're not safe to drive anymore. We're ripping the keys away from you. And we'll talk a little bit more about some of those strategies too. But also know that the legal risk, so liability and insurance, with insurance and liability, if a person is known to have cognitive impairment or dementia and is involved in an accident, insurance companies may refuse coverage and or raise premiums. So family members may face liability if they were aware of unsafe driving and did not act on it. So, and again, that's going to be per insurance, per group, and all that. So continuing with aware of unsafe driving can carry liability in insurance applications. So what do we do? Steps for families. We want to document specific accidents, specific skills that or those warning signs. So we can have those ready to give to the doctor, schedule an appointment, ask for a formal driving evaluation, and then contact the DPS if safety continues to be a risk. Now, I will say with this process and going through the DPS and the medical advisory board, that's going to take time. So if you're even starting to see a little bit of rebellion or stubbornness, then go ahead and start this process if you need it. You may can abandon the process and it may all work out, but at least it's started the process if you need it. And let's talk for a minute about, because I said at the very beginning, driving in dementia is more than just about transportation. It's about quality of life. And we want to look at this as not limiting driving, or to limit driving, but not limit living. Because driving is not just getting from one place to the next. It is getting from one activity to the next, right? And that can be anywhere from I go to the grocery store every other day to get my milk and my newspaper, and I get to chat with people. I get to talk to them. I buy coffee. I see other people in the stores. Periodically, I might go fill my prescription, at CVS or wherever. But I get to talk to the pharmacist. I get to see other people around there. Occasionally, I go to see the grandkids' ball games. So it's more of a social aspect than it is just transportation. So let's look at it as not stopping driving. We're not stopping their life. And this is a great way to have those conversations because they have their needs, and sometimes it's monitoring to, well, where does my loved one go? Why do they need this transportation? Because some of it is, I need groceries, right? I need my pills. But a lot of driving related activities are about quality of life. It's staying socially connected. It's going to these things I want to go to, but it's also just being able to regularly visit with people as I'm at the stores. So if we think about that, let's go ahead and start thinking about transportation alternatives. And if we can have these transportation alternatives already in place, it's going to help with the conversation. And it might be friends and family. Without having these alternatives, isolation happens pretty quickly. Even if our loved one's still living alone, but isolation also happens pretty quickly if they're with a spouse or they're with a kid, living with a child. There's still isolation that happens because not just for the person living with dementia, but that caregiver also. Mm-hmm. So let's think about, can we do a ride share with friends and family? Can we get a schedule going? And, on Mondays, that niece takes them to the senior center. Sundays, we're all going, the church member picks them up on the way to church. let's get a schedule put in place. So they're not, those quality of life or those activities that give them meaning and purpose don't go away. It's just how they get there to them is a little bit different, right? There's rideshare opportunities. There's, of course, taxis. There's Uber and Lyft now. That is a great way to do that. We can also, some of these things like grocery delivery and prescription delivery, we can just go ahead and have those delivered to the home. So that, takes care of that chore, right? But also just asking who in my circle can offer support. And on here, you see this is just Tarrant County transportation. Again, you'll have to look at this in your area, but that's public transportation. Even with North Texas not being a great public transportation area, there's a lot that's offered here. So, and it's knowing, and that's not an exhaustive list either, but it's knowing these resources as well. And of course, asking yourself, well, can my loved one navigate those resources? Like the bus might be too complex, but they can do a zip zone, which is a kind of like a private service. They come and pick you up and take you somewhere within a certain area that they can navigate a little bit better. So lastly, having the conversation. And I know I'm going to run out of time, but having the conversation is important because timing matters. When we start to have the conversation, please don't wait till there is an accident or there's a near miss or you just got out of the car with them and your anxiety is through the roof. That's not the time to have it. We want to wait until there's a calm moment, we've calmed down, and maybe we've already practiced what we are going to say. Okay, so we have what we're going to say. And don't ever think it's too early to start because these conversations, honestly, it's not going to be just one conversation and it's going to happen. You're going to need to have several small conversations over the course of a period of time. Mm-hmm. And then you want to ask who could be who's the best messenger? Because it may not be the youngest kid telling dad, you need to stop driving. Because he's not going to hear it. He doesn't need his kids telling him what to do. But it might be a best friend, or it might be his golfing buddy and his spouse, right? So we got to ask who's going to be the best messenger or messengers. You might need to have several people having the same conversation. And if it is different people, make sure we're having the same conversation and we're saying the same things. And it's always focused on safety. And then using specific examples. So here's a big, I think the most important thing to remember and why we need to practice these conversations is we don't want to lead with, well, you're an unsafe driver, or you just can't drive anymore. You are not aware of how bad your driving is. We don't want to lead with that, but maybe give a specific example of, I noticed you had a hard time parking the last couple of times I was with you. Maybe let's talk to the doctor about checking your vision. It's a thing specific like that. And I didn't lead into you're having a hard time parking. You can never drive again. Let's talk to the doctor about your vision. How do you feel about your driving and your parking? And here's some other examples here. These are kind of where more specific stuff can come up. And also have those conversations about, well, let me drive instead of you type things. But when you go to the grocery store, can I go with you? And then you're just already in the driver's seat when they come out. Or I'm going to the grocery store. Can I pick you up and we can go together? Right. Or if you want to talk about a warning sign, how did you get those scrapes on the car? And they may not be able to tell you. Mm-hmm. But it could be, hey, I think maybe you're just the judging of your distance is different. Maybe we talk to your doctor about it. What do you think? And include them as part of the conversation. Don't exclude them from the conversation. But those are some other examples there on having good conversations, because what does not help is arguing about it and telling them they're wrong and that they don't see that their abilities are changing. And threats or ultimatums are not going to work either. Now I say that, and I'll also say I've had several families say, if you're going to continue driving, you will not drive your grandkids. A lot of families will say that. I've heard that. My grandkids cannot be in the car with you when you're driving. So let me drive or let somebody else drive. And that, I consider that to be a boundary, not an ultimatum, but that's a boundary. Mm-hmm. And you might have to set some of those. We don't want to bring up old mistakes, and then we don't want to hide the keys or disable the car, without having these discussions, without kind of broaching the subject and talking about concerns and what's changing and what's happening, because this is a transition, a gradual transition. So it might be that let's not drive at night anymore. Let's not get on the freeways. Let's just do our short, familiar routes. So they're still driving, right? They still have that independence and freedom, but there's going to come a time where let's increase that family ride support, or community ride support. And then eventually there will come the time where we've got to remove access to the car. And know that there's going to be an emotional impact to this. This is hard on everybody, absolutely everybody. So there will be anger, there might be some fighting, there might be depression. This is grief. They're losing something, right? And as the care partner, we're losing something as well. So we want to work through these emotional impacts and allow it. Just know that this is not necessarily always going to be easy. They're going to get mad, they're going to get sad, and so are you. But working through that in a healthy manner. So we validate their feelings. We maintain other choices. So they're still making choices in the majority of the things in their lives, but we keep them connected to their quality of life and what gives them purpose and meaning. I think that's the most important thing. We're just reframing that independence. You're still being able to do your life, where just how you're getting there is going to look a little bit different. And then if all else fails, there are a few things that you can do. This is a last resort. But of course, we can remove the keys from sight. And it might even be removing the car from their sight as well. If they don't see the car parked out on the street, or they don't see that key bowl right there, they don't see it, they may not think about it. Mm-hmm. It's not that visual trigger. Or we arrange for the car to be sold. Or we're giving the car to a grandkid that needs it. That can be a little bit easier to swallow. If you're a 2-car household, then the one that's the caregiver, keep your car, but the person with dementia, that car, we might need to give that away to somebody that really needs it. And then you can put the car in for repairs. The car's still being fixed on, it's still being worked. And you could even have a mechanic emphasize that the car's not worth fixing. It's going to be too expensive to fix it. Or we just really can't figure out what's wrong with it. We're going to need it for a couple of more weeks. So we do want to be proactive and not reactive, because the changes will increase over time. And again, we want to make sure that we're acting early to protect lives, quite frankly, and to protect just the safety of everybody else on the road. So there's the summary. There's the references. We have information about the James Zoa Center, as we provide a full service of help for persons living with dementia. We have our residential short-term stays and short-term rehab. We have a senior day program here in Fort Worth. We have at-home services, and of course our education that you're taking advantage of today. I apologize, I've gone a little bit over, but since we're already over, does anybody have any questions or anything they want to share? And I'll check. Okay. All right. So I will send you an email with the copy of these slides. This will be downloaded to our YouTube page in the next day or two. And you'll also get information on our upcoming programs. I appreciate y'all staying with me a little bit late, and I appreciate you being here for this conversation. Y'all have a great day. Thank you so much.